I'm Stephen Guilfoyle with Afforded Care Insurance, and we're going to talk about Champion Health. And so today with us, we have Kurt with Piggly Wiggly. Now, most of the employers that are watching this right now understand the concept of Champion Health. They love the idea. But at the end of the day, you still can't help but think that it almost sounds too good to be true. The savings, the benefits, the app, and everything with it, right? And so for someone who's been on this plan for a couple years, what would you say to somebody who, business owners like you, that would say it's too good to be true?
Well, I thought the same thing, to be honest, Stephen. And in fact, my employees always came up to me and said, "What is going on here? This seems too good to be true. Is this going to be something that's going to affect me in the end? Is the IRS going to come after me because of the tax savings?" And honestly, it has been better after since year one. Year two's better. Year three's been even better. So the savings keep coming in for us and for the employees, and they get all the benefits of the Champ plan. So we're super excited that we joined 3 years ago.
Awesome. Well, we're super happy to have you as well. And I guess like your initial, when you're first approached, what was your initial thoughts, I guess, that got you so excited about it?
Well, the initial thought is I actually thought, okay, this is going to help our regular health care too, because this way it's something our employees can use before they even touch the health care that we have for them, which is going to help them because this way they don't need to be paying money out of pocket for deductibles. It helps us because of the fact that then we are going to keep our rates lower, which is going to be benefiting us along with the tax savings that we're receiving with the Champ plan as well.
Awesome. Okay. So, most employers I meet with, they agree the savings is a no-brainer, but I'd say the most common question we get is how easy is it for the employees to actually use it, and are they grateful for it?
Well, as far as grateful, who knows if employees are grateful for anything nowadays, but to be honest with you, I think they are. And as far as used, they use it, they have that card, they go in, they use that first before they do anything with the healthcare. So I've had about 10 people that came out to me and said, "You know what, I really am glad I'm on that plan." In fact, I had 2 people that the original year, they did not buy into it, they did not want to go on the plan. After other employees talked about it, guess what? They're on it now. So now I have all my employees on the Champ plan.
Wow. Now, I know, and this is another thing we've talked about in the past where, people that have an existing major medical plan in force, right? So, of course, there's that plan. And so, I guess, can you talk about maybe how this enhances it, maybe kind of with those copays and your own experience with that?
Yeah, exactly. So, like you talked about, Stephen, it really helps out because of the copays that you have with the actual healthcare plan that we have is now benefiting by having the Champ plans. So this way it's a whole separate entity, but yet again, it actually helps with that. And in fact, it's funny because my healthcare provider I work with says, "Well, how come your rates are so low?" And I'm like, "Well, I'm working with the Champ plan." So guess what? Now they want to actually work with you as well. So I gave them your information, so it's actually a win-win. So to any employer who actually is real hesitant on it, I say go for it. And actually what you could do is you could partner up with your health care provider you have now with the Champ plan and actually make it a synergistic situation for you.
Yeah, and to kind of expand on that, I know with a lot of times with brokers, like for instance, companies that have been with their broker for a while, they don't want to damage that relationship. They've treated them well and they don't want to, go anywhere, right? And so, with the Champ, what to me, I think one of the best parts about it is it doesn't push anybody out. You don't have to pick sides, and this actually helps the plan, right?
Yeah, it basically is the transition into something that's unique that nothing has I've ever seen before. When I was introduced by Matt, one of your folks from the Champ plan 3 years ago, and we talked about it, and he told me about it, I was like, this does seem too good to be true. But then once we got going on it and got excited about it and saw the savings from an employer standpoint, it's just a no-brainer. And like you just said, it's actually something that it doesn't affect at all what we're doing with the other healthcare provider that we use.
Yeah.